Let me turn it over to Mehmet to say a few words about what he's doing, what his team has uncovered, and what they're accomplishing with this new action. Dr. Oz.
Mr. Vice President, I appreciate the leadership on this. There's no question that his commitment, the Vice President's commitment to rooting out this fraud is going to make a massive difference in preserving and protecting our nation's public health programs. It's going to protect patients. I want to thank President Trump for pushing all of us to make sure we protect our most vulnerable Americans, the ones that JD mentioned, the ones he grew up with, the ones all of us know in our lives. It also protects taxpayers from attacks on our healthcare system. Secretary Kennedy has spearheaded these efforts, and thanks to his leadership, I'm proud to announce the largest fraud initiative, anti-fraud effort of its kind in CMS history. Now, why is this action necessary? Last night in the State of the Union address, the President spoke about the affordability issues that we have improved dramatically in this administration. But let's put some numbers on healthcare. The average family puts about $27,000 in the healthcare a year. They only pay $7,000 themselves, which is a lot, but there's an extra $20,000 invested for them. This is not a reasonable amount of money to spend. We have got to bend that curve downwards. It's unpredictable as well when you have to make these expenses, and the fraud that we're experiencing in America is making this already dangerous problem much worse. So we're going to fix these issues. The President last night spoke about the need for price transparency. That's going to help by making people more aware of what they're paying. It's also going to help us at CMS figure out what you should be paying and identifying fraud. To that note, the President announced last night that he's appointing our Vice President to lead the war on healthcare fraud, a wise choice. Your passion for this will make a huge difference. This is not about the money by itself. This is about people's lives and our culture, our shared values that have allowed these beautiful programs, Medicare and Medicaid, to survive brilliantly for 60 years. We believe, listen carefully, we are spending $300 billion a year in healthcare in this country for fraudulent, abusive, or wasteful purposes. $300 billion. Let's put that in perspective. If we could reduce fraud by 5%, which is at $300 billion, we would take the trust fund that's going to take care of all of us as we get older, and we would allow it not to expire in 5 to 6 years. We would double its life expectancy. That's massively important if you're going to trust the social safety net to be there for you. You deserve that social safety net. It's there, it's created. We're not going to let fraudsters steal it from you. The stellar CMS team, I want to call them out. Kim Brandt, who's videoing me over there, Dan Brillman, Capri Snap, Steph Carlton have worked tirelessly to put this together. They've been rooting out criminals all year long. I know as well what it's like. I visited all these areas, personally witnessed what it's like to see something you know is wrong and wonder why no one tried to fix it. It's infuriating. The Vice President described very accurately exactly what you see on the ground. These self-serving scoundrels, that's what they are, who rob our federal and state health programs, have decided it is worth the risk. I'm going to make a proposition to you. If you commit crime on Medicare or Medicaid in America and you steal, let's say, a couple $1 million, your jail sentence, first-time offender, maybe a year. For a lot of folks, that's a good deal. We have to take these crimes seriously and treat them as seriously as if they were bank robberies, because they're more dangerous than bank robberies. People get hurt during them. Let me share some of these horrible stories. The Vice President started highlighting autism. Let's get into the details of what's really going on in Minnesota. These are real cases from our group at CMS. These are adjudicated numbers. There's a fraud scheme in Minnesota where criminals, soon-to-be criminals, pay moms $1,000 roughly in order to enroll their children as being autistic, falsely, dishonestly claiming their children are autistic. They then bill Medicaid, this has already happened, millions of dollars for services that were never rendered, never delivered by a qualified staff member. These schemes disproportionately involve immigrant communities. They're insulated, they're able to organize efforts, and sometimes they don't understand what's going on. And it ultimately diverts resources away from kids who truly have autism, because if every kid in the neighborhood has autism, then nobody has autism in terms of how you can manage them. There was one behavioral, and by the way, these kids, they carry that diagnosis of autism the rest of their lives. Their mom made a bad decision, the kid pays the price for the rest of their life. There's one behavioral health organization, Mr. Vice President, in Minnesota. They received $11.5 million in Medicaid payments, but the top biller submitted 450 days where they claimed they were working more than 24 hours a day. I mean, even in the White House, that's tough. It's hard to work more than 24 hours a day. How it didn't get picked up is shocking to us at CMS. There are other red flags in Minnesota, including hundreds of beneficiaries receiving treatment linked to one location, which was impossible physically to be true. We had 8 beneficiaries in one of these substance use disorder centers, 8 who were already dead, but the center was still billing us. Not only did they let the person pass, they kept billing for it. That's the level of avarice we're talking about. So CMS is done paying and chasing. We don't think jail sentences are the right way out. These criminals flee the country. Many are foreign nationals. Instead, we're launching the largest action against fraud that we've ever taken. The money's not going to ever leave the building again. We're going to start draining the swamp of the crooks that have inhabited it and are defrauding us. There are 3 bold actions. The first, and for many of you maybe the most important, is we're going to, for the first time, take a massive action to defer funds to a state. Let's start with this Medicaid program in Minnesota, which serves pregnant women. Medicaid takes care of our children. 53% of kids are born in the poverty. They're supported through Medicaid. Disadvantaged seniors, individuals with disabilities. It's imponderable that you would take advantage of these precious programs, yet they're putting it at risk, all of it, by stealing the money. So it's our duty to preserve Medicaid, and what we're going to do is identify the scammers, which we have done in Minnesota. We've identified that they've hijacked, in particular, a certain part of the Minnesota Medicaid system. Said differently, and I'll just put the numbers out there, it's going to be $259 million of deferred payments for Medicaid to Minnesota, which we're announcing as I speak to Governor Walz and his team. That's based on an audit of the last 3 months of 2025. Restated, $250 million is not going to be paid this month to Minnesota for its Medicaid claims. Now that's $250 million of money. That's your money. It's your taxpayer money. And these home and community-based services, which again are services that are typically things you would do for your family, but for whatever reason your family's not there to provide them, are very hard to audit. And for that reason, there's been a lot of slippage. The guardrails have not been well maintained, and if you're not serious about the integrity of the program, you'll see these problems happening in your state, which is why Minnesota's not alone, although they're the first to receive this action. These high-growth areas of fraud are difficult to police, so we require the states to take these issues seriously. This $250 million deferment is hopefully going to get on the radar screen for the state of Minnesota and make sure they are responsive to our requests. We did what any honest and patient-focused agency would do. We have notified the state and that we will give them the money, but we're going to hold it and only release it after they propose and act on a comprehensive corrective action plan to solve the problem. If Minnesota fails to clean up the systems, the state will rack up $1 billion of deferred payments this year. Governor Walz has 60 days, sir, to respond to our letter. And if providers and beneficiaries are worried about getting their money and services, please call your governor. These are services the governor has already paid for. We are just not reimbursing the state. And to make it clear, there is a rainy day fund in Minnesota, so we are very confident that people will not be hurt in Minnesota. This is not a problem with the people of Minnesota, it's a problem with the leadership of Minnesota and other states who do not take Medicaid preservation seriously. Any delay in services is going to be, should be laid at the seat of Governor Walz. I believe he will take this seriously. They're not the only state that's floundering. We have more announcements with other states coming soon. Second big issue has to do with Medicare. So that was Medicaid in Minnesota, takes care of our most vulnerable populations. Medicare takes care of our seniors. Durable medical equipment. Most of you have not thought much about this category. These are the folks who they serve wheelchairs, canes, they sell knee braces, catheters, Foley catheters. Durable medical equipment suppliers, because they ship prostheses and these items, they're a great target for fraudsters. Here's what they do. They can steal the beneficiary number, and they never ship the product. They pretend to ship the product, but nothing ever gets sent out. So there's no cost of goods sold, there's no inventory, there's no payroll, no one works in the place, it's empty. But they generate millions of dollars of fake bills. There was a national DME fraud scheme that generated $1.1 billion recently in fraudulent orthotic brace orders. The beneficiaries whose numbers were stolen and used, they couldn't get those products. Imagine if you're at an insulin pump and someone steals your number and orders an insulin pump fictitiously, bills Medicare, and then you come and try to get this to deal with your diabetes. You don't get it. That actually happened. And what happens to those patients? They don't know if their blood sugar's so high or so low that they might die. That's the risks that we're allowing by not taking this seriously. So today, issue number 2 is we're announcing a 6-month national moratorium blocking all new enrollments for durable medical equipment, prostheses, orthotics, supplies across the board. These crimes are becoming a major source of fraudulent activity. And I'll just mention, Mr. Vice President, South Florida. Do you ever go to McDonald's?
Yeah, too much.
We had rehearsed this. So there are twice as many durable medical equipment suppliers in South Florida than McDonald's.
Wow.
And that's not because Secretary Kennedy is closing down McDonald's. That's because the amount of fraud is so massive that it's easier to open one of these suppliers than open a bank account, which is why we're working with Secretary Bessent. And part of the reason for this moratorium is it gives us time to be able to deal with these issues that have become massive. And if we just shut down South Florida, they'd all flee to California and to Texas. So we have to shut the whole country down. This unfortunate necessity is going to allow us to get on top of what we believe is billions of dollars of DME frauds. We've already stopped $1.5 billion of billing, but we need more time to shut down these bad guys. But it's going to be effective, and it's not going to touch the people who need these services. We have designed the system so that all the people who are already selling products can continue to sell products until we check them out, but no new DME enrollments, no ownership changes, all the things that fraudsters have done historically will be blocked. This way we're preserving access, but we're not allowing tax dollars to be stolen. Now, you may be asking, why is it so important to crush fraud to assure the affordability of our nation? I'll just give you one example that we just finished dealing with. The Vice President's aware of this. We had skin substitutes that were generating, we believe this coming year, $23 billion in billing. Because we're able to shut that down to where it's supposed to be, because they have a role when used appropriately, every single senior in America, everyone, is going to get $132 extra money this year, just from that one thing that we shut down. That's the amount of money we're talking about, and it affects all of us. And to that note, because every one of you are affected, we want all of you to help us. So the third big announcement is we want to crush fraud by crowdsourcing ideas. We're issuing a request for information. We need and we want your help. The Vice President, myself, the President, Secretary Kennedy, all of us know that all of us are smarter than any one of us. So what can you do? We want your input on how to prevent, detect, and respond to fraud in government-funded healthcare. Whatever ideas you have, we're interested in. Our goal is to supercharge program integrity over the next 6 months. So we put in a request. That means providers and suppliers and payers and technology companies, patient advocates, beneficiaries. If you see fraud, you let us know. A state Medicaid director can show us patterns of fraud that we're not aware of. A provider can help understand compliance burdens and how to deal with those more effectively. Patient advocate, get cracking on making sure that people are aware of fraud. And like we have done already this year, by pulling in those kinds of ideas, we've stopped almost $6 billion from leaving the building, but that leaves a lot more out there that we can take advantage of. So over the next 60 days, the Crush Initiative we just issued is us asking you to help us build something better, to help the brave patriots out there who want to play a role to play a role. Call 1-800-HHS-TIPS if you see fraud, or just go to cms.gov/fraud. Those are simple, easy ways for you to help us address the problems the Vice President highlighted. God bless you all. So on December the 7th, we sent a letter to Governor Walz asking for a corrective action plan, which is a mechanism for us to extract from the state what they think they can do to fix the problems. The answer we got back at the end of the month, which is what the deadline was inadequate. We alerted them to this. We issued guidance that we were going to defer income based on an audit of last quarter's money. So we actually went dutifully through all of the bills that were sent to us. We found that of these high-risk services, roughly half of them, you really couldn't trust the data we were looking at. It's not that the numbers don't add up. The backup to the numbers is not there. So what do we need to have happen? We need to know that the providers actually are the real providers. Oftentimes, there's no person that you can associate with the treatment itself. We need you to, after you adjudicate who these providers are, make sure they're not already in trouble for doing bad stuff, and then evaluate all the current providers to make sure they're supposed to be able to provide these services. And there's a whole slew of tools that we can use, including checking before you pay the bill that the bill is legitimate. That prepayment review is incredibly important. It's cumbersome. It's clunky. We wish we didn't have to do it. But I'm going to highlight something that the Vice President mentioned. These are services that we normally would not pay for. They're services we give to you because your family can't do them for you. If it's a hernia operation, there's a dozen people who have credentials, licensing, we can use a scar. But if your service is transporting you to the doctor's office and you can't tell me who actually drove the car and why they billed so much and did the patient even go to the doctor's office, then we have to do our job, which you would want us to do, which is to ask for some backup, and there wasn't any backup. So to echo 60 days, that's the deadline. We expect to hear back. We've been following the rules meticulously to do this correctly, which is one of the reasons we're optimistic will be effective in Minnesota.